Tennessee is one of the poorest states in the nation. There is a health crisis, both because of our poverty and because of the red tape and the polarization of healthcare. In 1996, I was selected as an Equal Justice Works Fellow, which allowed me, along with Gordon Bonnyman, to start the Tennessee Justice Center. We are red tape warriors, working with clients one-on-one to get them the services they need. We also fight for systemic change to ensure that every Tennessean has access to adequate health care. People are choosing between medicine and food. We can do better as a nation. Surely we can do better. We pay. In Tennessee in the mid-90s, there were 700,000 children who depended on our state Medicaid program, and many of them were being denied essential benefits. Having moms who have to watch their child suffer and feeling powerless, I can't imagine a worse reality. But let's roll up our sleeves and solve the healthcare problems that are facing our families. I led a class action lawsuit against the state to hold them accountable for these 700,000 children, to give them the health care they needed to reach their potential.
You too.
It's so long.
So good to see you. Hey, Megan. Hey.
I was really worried that families wouldn't find me, and then I got a call from Linda Allen. She was this amazing mom who had adopted or fostered over 30 kids.
We did foster care for medically fragile children for about 25 years. The state made it almost impossible to get the care, and it was not given. Usually, it was like a nightmare. I became involved with the Tennessee Justice Center when my foster child, John B., was in the hospital. And we were lucky enough to have the case named after John.
We worked on this case for 13 years. The other side had enormous power and enormous interest in ensuring that they had the power to deny care to kids. I would walk into court, sometimes by myself, and the other side would often be represented by 5 different law firms. And so there would be literally 15 different lawyers and me, but I felt way more powerful because behind me were these clients whose courage and love was just overwhelming, and they changed the system. Through our class action lawsuit, we changed the policy to ensure that every child had the health care they needed and that their doctor ordered so that they could thrive.
When I first met Michele, I was so inspired by her spark and her tenacity and her persistence. And so I joined the Tennessee Justice Center Board of Directors and been here for more than a decade. My parents are farmers. They are some of the hardest working people you will ever meet, and they couldn't afford the private health care premiums. I had been a child in Tennessee covered by TennCare health insurance, and therefore a member of the John B. class. Thanks to Michele and the work of TJC, we, my family, were able to be healthy and successful, just like every child in Tennessee has the right to be.
Since starting the Tennessee Justice Center, we have served 10,000 individuals in one-on-one representation in all 95 counties of Tennessee. We've secured $2 billion in health care services. We have won 1.4 million Tennesseans appeal rights when their HMO denies the health care their doctors say they need. We've improved access to health care for 750,000 Tennessee children. So what started as one investment in me has enabled us to have an impact on hundreds of thousands of Tennesseans, not just in this generation, but in the next.